The information provided on Dr. Tom Rosell Live by Dr. Tom Rosell, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom. So guess what? We got another program for you, one that I think you're going to spend a little attentive time listening to some of the warnings I'm going to give to you. What we're talking about? We're talking about something that, in my opinion, is causing a lot of problems. We're talking about Botox, but Botox as it relates to the control and treatment of migraine headaches. Now, why are they using that? Well, they think that if they relax the system, which Botox does, right, it paralyzes the muscles that it's injected into. It relieves the pressure, and subsequently, you don't get the migraines. Well, migraines are a very interesting platform, and we've got to really understand what they are and why they come about, and then understand why perhaps using Botox may be not the solution and could rebound and cause more problems later on, but also because the neurotoxic effects, the side effects, if you will, of this substance. You're playing a little bit of Russian roulette, in my opinion. And there's studies that are out there from all over the world that say that I might be really right. So let's get into it just a little bit. There's a tremendous amount of, be careful with this stuff, but let's talk about the migraine itself. Migraines, by the way, are extremely treatable. There are things that you can do to make them go away and never come back again, but you have to understand what they're from. And we've talked about a little bit what migraines are triggered from in past programs. And I think the last one that we did, we said that they can be vascular from some platform, whether they're inflammatory vascular, whether they're compression vascular, whether there's something that is not going on in the brain the way it's supposed to. It's called an inflammatory reaction or inflammatory cascade. But this is a serious subject, and it's one that I want you to really pay attention to. I don't want you to go out and start injecting your head with Botox, which is a toxoid, which is a poison that can cause other problems as well. It's dangerous as far as I'm concerned, and you're causing yourself a problem. So let's get into it just a little bit. Let's talk about, we'll start with a good old fashioned, what is a migraine, and, is it being not defined properly, or is it being too broadly defined? A migraine, if you will, is a complex neurovascular problem. Complex, meaning it's not just one piece of the puzzle. And remember what I said, vascular, that's blood supply. Something's going on with the blood vessels as well. Something's affecting the nervous system. When it's present, it's ugly, it's intense, it's throbbing. It's often characterized with one side of the head more than the other, and it can last for hours, it can last for days. I've had patients that have come in the middle of a crisis, but they've had it for over 30 hours, and it just doesn't want to stop. Sometimes you get vomiting, sometimes you get nausea where you feel like you're going to vomit, but you don't. Extreme light sensitivity. You need those deep, dark sunglasses. Actually, you want to be in a dark, cold room and just sit there and hopefully and pray that it goes away. Migraines are extremely debilitating, and they can be triggered by lots of stuff. It can be triggered by aberrations in hormones. Ladies, the reason that you get more migraines in guys is because of the imbalance, if you will, in estrogen flux. So you get that time of the month where the estrogen level starts going up. That's when you go into ovulation, but there's not enough progesterone to blunt it and calm it down. That, in addition to environmental estrogenics, which we call xenoestrogens. Sound can trigger them, light can trigger them, stress patterns can trigger it, position can trigger them. We talked a little bit about that. You have a blood vessel, if I remember the past program, which I do, that there's a blood vessel that goes right through the bones of your neck, and the blood vessels are called the vertebral arteries. They go up one side and they go up the other. Now, as they come together, they form the circulation to the back part of the brain. If the circulatory process is altered in any way that slows down the blood supply to the brain or to the back of the brain, what happens as soon as you relax, there's a huge rush of blood, and the blood vessels now have been narrowed down to the point where they can't handle it. So if that's the case, do you think you're going to have pain? Absolutely 100%. But it's a result of the alignment of the bones that are causing that restriction of blood flow. Now, how do they normally treat these things? Well, they treat them by what? They treat them by using all kinds of medications. They're talking about, multiple different types of things. Sometimes you get a migraine and there's pain all over the body, and they group it into a clump. And, well, you have a triggering mechanism of fibromyalgia. I don't think so. There's just another way of saying we really don't know what the heck we're treating. And, we have to make sure that we tag it with something so your insurance company will pay us to do whatever it is that we're going to do. Not okay. So the next thing that we need to understand before we get into the program is what is Botox? And this is the thing that you really have to understand. Botox, if you will, is made from botulism. It's a botulinum toxoid. And when you look it up, it'll say botulism toxoid type A, because obviously there's other types, but it's a neurotoxic protein. And it's derived from this bacteria, bad one, called Clostridium botulinum. Now, big words, but it simply means that you're injecting a paralyzing toxin into your skin, and it can absorb into other parts of the body as well. So when you're injecting this Clostridium botulism, if you will, into your brain, into your temples, into the back of your head, anywhere in that area, do you think that there might be something that you need to be wary of? Well, I'm here to tell you that, you better pay attention, okay? So botulism, this biotoxic type A, it's the main active ingredient of what they call Botox. Botox is a manufacturer name. And it works by blocking the release of something called acetylcholine. And what's acetylcholine? Acetylcholine is a neurotransmitter. It's one that allows the transmission of an impulse from one nerve ending, if you will, to another. So what happens then is responsible for, acetylcholine is responsible for muscle contraction. So the thought process is that because this acetylcholine level gets too high, that it causes the muscles to stay contracted and subsequently all those things that we talked about. But they're still off the mark. These are muscle contraction type of headaches. These are not necessarily they're not necessarily migraine headaches. Can they trigger migraine? Perhaps, but they're not necessarily a migraine. The temporary, and they say it's temporary, but what we're finding out is that it can become permanent, slowly degrading over time. The temporary paralysis, if you will, of these muscles that they're injecting this toxoid in helps do all kinds of things. It allows the muscle to relax. It's been used for, cosmetics, because it takes all the wrinkles out of your face and it just flattens them out. And it's only because it doesn't have any contraction at that point. You've lost the ability to control the muscles of your face. Now, human, if you will, human serum albumin, you've heard that before, right? That's another protein. It's derived from human plasma. It acts as a stabilizer in the formulation of Botox. It helps preserve the botulism toxoid, and that's what it's called. It's a botulism toxoid, and ensues the productivity, the stabilization, and supposedly the safety, not of you, but the safety of storing it for long periods of time. So, it's another topic we could get into. There's something called saline, which is sodium chloride. Now, saline is biologically inert for the most part. Saline meaning salt-like type of solution. The biotox solution, or the botoxoid, is diluted with a small amount of saline to achieve, if you call it, a balanced concentration. Now, not all laboratories make the same platform. So, it's out there doing things. Now, safety administration, when you look at this thing, it's talked about that while botulism can be lethal. And they say in large dosages, but we know that sensitive people can react in much lesser forms. It's used, if you will, uh, in these supposedly purified solutions of saline and albumin and so forth. Uh, they say it's safe, for medical administration and so forth. But I'm here to tell you that in our experience clinically with people who've had different numbers of Botox injections, it ain't necessarily true, my friends. There's other things that come about because of the injection ongoing of biotoxoid. So let's go back and just kind of relook at what we just talked about for a second. What's a migraine? I want you to remember these. Migraines are a hormonal, vascular meaning blood supply, type of headache. And it's triggered by allergy reactions. It can be triggered by hormone imbalances. It can be triggered by restriction of blood flow due to something. We often look at the spine, and more often than not, it's involved where the vertebrae, the bones of the upper portion of the neck, are out of position in a way that is causing compression, irritation. So you have to kind of begin to break it down. Odors can do it, lighting can do it. And then we start saying, why is the light triggering it? Often there's a neurotransmitter problem that is in the system. Now, where are the majority of neurotransmitters made? In your gut, in your intestinal tract. Some authors will tell you up to 75 to 80%, but we know at least 70% are made in the intestinal system. And where they said doesn't cross the blood-brain barrier, we know today that that's not true, that they do cross over. So the gut has to work well. You have to have good microbiome. That means good bacteria in your intestinal system. And you have to make sure, if you will, that it's producing the things that you need to regulate and to balance, the things that we're talking about. It's critical. These are things that, the traditional mainstream allopathic platform is not going to necessarily. They say, well, it's okay. It happens once in a great while. Are you the once in the great while? But I'm here to tell you that unfortunately it does work and cause side effects much more rapidly, much more quickly. We're going to get into, as we go through the program today, we're going to talk about the side effects and what you need to look for and why I am cautioning you today to be very careful. I'm going to cite some studies from Cleveland Clinic. We're going to talk about some other very well-known institutions that are basically saying, yeah, it works, but is it worth the side effects? Okay, so if you looked it up and said mild side effects. So what are the mild side effects? Well, irritation at the injection site, pain. Yeah, right. Okay, so they say that for everything that they inject in your body because they're going to put a little pin in there and they're going to say that, yeah, a little hurt there, right? A little redness there, a little swelling there for some people. And then they're going to talk about in this type of situation that you can have paralysis or a drooping of the face or a weakening of the muscle patterns. You can end up with stiffness and the inability of turn your head around. And guess what the side effect is? Headaches. You're trying to inject Botox to get rid of the headache, the migraine, or the triggering pattern to the migraine, and yet the side effect, like so many other drugs, are the side effects that it's actually trying to prevent. And it's called a headache, and it can be quite significant. Now, usually, according to the medical literature, that these headaches and these droopy skin patterns are manageable. They say manageable with proper care. So they're admitting it, right? But we're going to manage it. What does management mean? Well, we'll get into that just a little bit as we go through the program today and talk about what that really alludes to, right? So these are usually, according to the literature, and this isn't me telling you that's usually, they're saying that they're manageable. Nah, not necessarily so much. And then they go into, they say, well, it can happen, but in our estimation, it's not that often. It's rare. And what they're talking about is muscle weakness paralysis, and it can spread into other areas of the body. So let's say that you're going to inject the back of your head, and all of a sudden It relaxes the muscles so much. Now you have an uncontrolled blood supply to the brain. Could that cause too much pressure on the blood vessels of the lower portion, the basal area of your brain? Maybe, right? It's something to think about. And actually, some of the literature shows that if it's reported well. Now, VAERS, which is Vaccine Reporting Injury Platform, we already know that with the vaccine injuries are a fraction of what really takes place. Same thing with these studies. The side effects are often not reported. And if that's the case, then we have to take the reported side effects and at least go 10 times that. You heard me, at least 10 times, and increase the, if you will, the impact that it actually has. So the side effects can be quite significant. You can't ignore them. The side effects can be anything from that droopiness, that paralysis, increase in headaches, the spontaneous onset of headaches, but that weakness, that paralysis that is due to the toxoid is because it spreads into the neurological bed, and it's not necessarily at the site. By the way, it can also affect swallowing. It can affect your breathing. It can affect, it puts you in a seizure-like type of process. Allergic reactions, and again, the medical literature says it happens, it's rare, it's not there, but it can cause very significant impact. So don't just kind of put it, one and done. Make sure you understand that there's a problem. Coming up on the 18th of March, very quickly now, right? We're going to be doing a program in-house. Dr. Qinglong Zhang and I, who is one of the best in the world in traditional Chinese medicine. He's also a chiropractor. He also knows herbal medicine like nobody I've seen. We're going to be doing a program on chronic headaches and migraines. And the guy's a master at it. He's amazing. And we're going to be talking about what happens and why certain things present themselves. And, as usual, those of you who've been to the classes, if I'm not doing that by myself, I'm going to jump in and I'm going to add these tidbits, these antidotes. But we're going to give you things that you can do to help yourself to make a huge difference. That's coming up on the 18th at 6 p.m. at the Roselle Center in Fairfax, Virginia. We're right near the National Capital Beltway. Please join us. All you have to do is go online to drtomroselle.com and you'll see a site. Click, register, make it happen. And, this is a class, it's our gift to you. You have no obligation. Just come and listen. Go in with a ton of information. Tell your friends about it. And by the way, having said that, what I want you to do is make sure you follow me on all the social media sites, because we're always putting things out there. You can find all kinds of information. If you go to drtomroselle.com, there's a ton of data. Listen, we're coming up to a break. I'm really going to get into a deep dive on this migraine thing with Botox injections, because you need to know. I'm the guy that's going to tell you the truth. I'm not going to pull anything back. I'm going to tell you where you can find the information. I already mentioned Cleveland Clinic, one of the best in the country. And if you dig into their applications and their studies of things, you're going to say, hey, these guys did the job, and they're going to finger point. And here's the deal. If they say that it's minimal, 10 times that, okay? If they say it's minimal, it's 10 times that, because people don't report, docs don't report the side effects. They're supposed to, but they don't. I'm telling you, they don't. And it's absolute 100% for the most part, it's not there. We're coming up to a break, and I'm going to get in deeper into the weeds on this thing. And then I'm going to give you some things that you can possibly do to make a difference towards the end of our stay together here. And I want you to understand that there's so much that's resolvable in a natural platform. And you don't have to rely on drugs. You don't have to rely on surgical intervention. But what happens if you did something silly because all your friends went to a Botox party? You've had these migraines. Guys, oh, yeah, let's inject. There's no big deal. And they inject the back of your head, right back here. And all of a sudden, it affects the nerves that go to your throat, the glossopharyngeal and the hypoglossus, right? What happens then? Now, all of a sudden, you can't swallow, but it can happen. I promise you, there's so many things that you're not aware of, and we'll talk about that when we come back from the break. But you're listening to Dr. Tom Rosell Live. We have a whole lot more that we're going to stack on top of this. I want to get your attention today. I'm doing this on purpose, absolutely 100%, because you need to have the information. Don't go away. I'll be right back after some very important messages. This is Dr. Tom Rosell, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Rosell Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellcare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Rosell and the Rosell Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Rosell's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomrosell.com/education. That's drtomrosell.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Rosell. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Hey, everybody, welcome back. Dr. Tom here. You're listening to Ageless Health with yours truly. And it really is about your aging the way you want to age and making sure that you can continue the process as long as you want. But you got to have the tools for that, right? You have to know what you're doing. And if you don't do anything else except take the information that I'm giving you and question your practitioners and see what they have to say. Watch their body language when you ask something. If you ask them something and they kind of look away from you, it's because they don't have the answer and they're going to try to, give you something that's plausible. If they react quickly and they want to knee-jerk hard and say, no way, it's not happening, then you can be sure that there's maybe some truth to the question that you asked, simply because nobody wants to be wrong. And they're not bad people. They're really not. But they're being told a standard of care that may be inadequate and it gets you in trouble. And you need to know as much as you possibly can. So let's get back into the program. Let's talk about this Botoxoid neurological paralyzing, excuse me, it's funny today, right? Paralyzing substance that people are going crazy and injecting themselves with. So Botox is a brand name. It's a copyrighted brand name. And if you go on and you look at it, you know that it's botulism and it's a type A botulistic pattern. We said that there's all kinds of crazy side effects. The ones that they admit to are like pain. Okay, sure, you're being stuck with a needle. It's going to turn red. So, but how about the paralysis that it causes in the muscle? If you put it in your forehead, you may end up with droopy eyes and you're not going to be able to get the tone back. How about the neck pain, the stiffness, and the headaches that you're trying to get rid of? We're talking about migraines today. But guess what happens? It's triggering an onset of that type of situation because it's disturbing the blood flow, or it's causing a neurotransmitter. Remember those little guys that I told you that allow one nerve signaling to go to another nerve signaling? Well, those are the things. But and you read and say, well, these things are rare. Well, not so rare when you consider that the reporting is probably a tenth of what it should be. So take whatever's out there and times it 10, and that's exactly what takes place in the case of this or any kind of vaccine injury as well. So let's jump back into it. I want to get into a little bit of information that came out of Cleveland Clinic, right? And again, so Botox, this botulism, if you will, I said botulism, it's a poison, can help relax muscles enough that will, in fact, help prevent the intensity of different types of headaches and even migraines. But remember, if it's working, it's because it's going to the place where these muscle contractions are causing a triggering mechanism when it comes to a lot of transport mechanisms of the brain. So if you have these ongoing headaches, there's ways of fixing it. First, you got to understand where they're coming from. So, well, it's because your muscles are too tight. Well, if that's the case, why don't you ask the question, why? Why are they too tight? Where's it coming from? Could it be that you have what we call a spinal subluxation where the vertebrae are out of position? Maybe, could very well be. But I would check that out first because it's easily correctable. If you've heard me talk in the past, I said the reason that I'm in the world that I'm in is because my wife had migraines from the time she was 6 years old and got progressively worse to the point when we were in college, she'd lose at least one day a week, either the migraine or the medication she was taking. And we found out that it was the blood supply, if you will, that goes through the bones of the neck, comes together at the base of the brain and supplies the circulation at that level. So what would happen is that she was in such tense because this is a crazy academic, this lady that I'm married to, and she'd be tense with her head bent down, so her spine was totally reversed. And when she'd relax on the weekend, that blood supply would hit just like a dam that lost its barrier, and the blood supply to the brain, the vessels couldn't handle it. And that's where the headaches came from. And what cured her? Straight up old-fashioned good chiropractic care that relieved the pressure, got the curve back to where it needs to be. And she's today, all these years later, and I've been in practice almost 5 decades, all these years later, she hasn't had one since, right? And by the way, she gets treated on a regular basis just to maintain her health. But Botox works by blocking the signal of muscle contraction before it reaches your brain. So during a migraine, there are certain nerves that will become sensitive, and they make that a big deal. But what it really is that the meninges, that's the covering of the brain, inside the bone portion, this big old tough thing, these 22 bones inside covers the brain, attaches 4 different places on the skull. And what happens is this meninges gets sometimes torqued or too tight. It pulls on things and it relaxes that covering. Now, if that's the case, if these injections are supposed to be specific to muscles in your head and your neck and your shoulders, why is it affecting that meningeal covering, that hard saran wrap-like covering around your head? Well, it's because it's attached 4 different places. But now when you relax the muscles that control the head, it's going to trigger something else. So what happens is that these nerve signals now become inhibited, if you will, and the Botox can travel That doesn't say localized and just affect one muscle. It travels. And now it gets into the tissue. I was talking, offline a bit ago. I had a patient, and this goes back quite recently, that she had had 3 injections at the base of her skull to relax the muscles with Botox. And on the 3rd injection, it had gotten into the nerve platform that controlled her speech and her swallowing. She lost her voice and she was challenged with being able to swallow and to breathe. I don't know about you. Are you willing to take that risk? Not me, not this boy. But if that's the case, if it's going to happen to somebody, who's it going to happen to? Look, here's the deal. If it releases chemicals that can block and paralyze things, why in God's name would you want to put it in your body anyway? I don't know about you, but it's not going into my system. Botox helps calm the nerves, right? That's what it's supposed to do. But how does it calm that signaling process? There's a whole chemical pathway that's involved that way, and it can help reduce that inflammatory reaction that is really what's causing the migraine, if you will. Remember I said migraines are either vascular blood supply or inflammatory, generally relative to what's going on. They can be triggered by muscle tightness, but there's many ways of making that go away. You don't want to add insult to injury and potentially end up with something else that you didn't ask for. So medically, they say, well, it's just like a muscle relaxant. No, it's much more significant. Muscle relaxants also have their issues, but once you like to get rid of it, remember, there's only 3 things that cause anything. There's either going to be injury to the body in some way. There's going to be biochemical, biological irritation, insult that's environmental, it's things you put in your mouth that shouldn't be there, and so forth. And the 3rd piece is an ongoing stress pattern. Remember, we've talked about in the past where, if you're tight all the time, you're clenching your teeth, hip abduction is not going to work. Your head and neck and shoulders are going to be constantly tight. You're going to trigger migraine patterns, all kinds of things like that. Why don't we fix the cause? On the 18th, coming up, just in a very short period of time, a couple of weeks from now, Dr. Qinglong Zhang and I are going to do an in-house program on chronic headaches and migraines. But we're going to tell you what the triggers are and what you can do about it, how you can fix this stuff. Wouldn't you like to fix it instead of dealing with it and putting up with it? I don't know about you, but yeah, absolutely, 100%. Let's get through those things. Give us a call. You can do 703-698-7117 and tell our staff that you would like to join us, and they'll take your name and phone number so they can let you know if something happens. Or you can do it online. Go to drtomroselle.com or rosellcare.com and make that happen. By the way, while I'm thinking about things, we've set up, if you go to either one of the websites, you go to drtomroselle.com or rosellcare.com. So many of you over time have asked me, how can I buy good nutritional products? Well, we set it up for you. You go to Roselle Ageless Health Store, go to rosellcare.com, or go to drtomroselle.com and go up to the toolbar at the top, and you can see Ageless Health Store. And if you click on that, you're going to find a shopping area that you can go in that we've hooked directly up to manufacturers and so forth. So the agelesshealthstore.com, if you will, agelesshealthstore.com is the place to go. There's things there to keep your immune system. Matter of fact, you're going to see 4 products up there that I recommend to my staff. I recommend to my patients. I take them every day, and I stay well because of it. So if you want to buy something that will keep the bugs away, there's air tamers that are there. You can click that. Air tamers will knock out about 90% to 95% of all viral patterns within 20 minutes of wearing them. It's your own personal filter. During the time we were chasing all the viruses are chasing us. I wore those when I flew, when I went different places, and never got sick. So how about you? Why don't you do it? And then, again, we have the products that are there to maintain your immune system and increase your health platform, your health index. So get it done. Go to agelesshealthstore.com, and it's all there for you because you asked for it. You wanted me to get it done, and so we did it for you. Let's get back to the program. Got a lot to talk about today. So let's recap just a little bit. We talked about, these Botox injections are really what? They are botulism. Botulism, they're a neurotoxic protein, and they're derived by a bacteria called Clostridium botulinum. And it's pretty ugly, right? It'll kill you in high enough dosages. It will kill you 100%. Absolutely. Don't let anybody tell you that it won't. So what they say is that, yeah, but in small dosages, and we put a little human albumin around it, and we put a little sodium chloride around it. We balance it out. It doesn't have the impact. It's safe. Yeah, not so much. I mean, they have to admit that in some occasions, you got people that end up in trouble. I just told you about a patient of mine that, she ended up in a real deep hole because of the third injection that she had with all kinds of botulistic patterns. Look, this is not without its side effects, and don't let anybody tell you that it is. You look up, you go say, have people died from Botox head injections? And this one site comes and says, no, absolutely no, not at all, period, end of story. There's been millions of people that have been injected. No one's died. That's a lie. It's not true. There's cases that have happened. Look overseas, go to, British Medical Journal, look at things like that. Even if you go into the CDC, if you will, and there was an article that was published in the Associated Press. This goes back 2008, and they were talking about this anti-wrinkle drug, which we know is being used for migraines now. And they were talking about, it relaxes the muscles and so forth. But they also said that the biotoxoid, and I'm going to read directly, said might have spread to other areas beyond the injection sites, resulting in such problems as paralysis and of the respiratory muscles, that's your breathing pattern, difficulty swallowing. That's from the FDA. That's from the Federal Drug, that the omnipotent ones. Even they're admitting to it. So the FDA said that deaths supposedly were in younger people. Well, if it kills younger people, won't it kill you? I don't know about you, but it's not something I want to put in my body. Not going to happen. There's just no way that we're going to deal with this stuff. Look, there's so much that you can do without taking the risk of putting something that is ugly and potentially dangerous. And I use the word ugly, not making you ugly, because all of you are taking it simply because of the fact that, you think it's going to make you pretty. It's going to get rid of the wrinkles. Like you're sitting like that. I should go in and inject my forehead and get rid of the wrinkles. It's not going to happen. It's I'll sit there and put different oils on my face, and I'm Sicilian, so I love olive oil, and I'll do that kind of stuff on an ongoing basis, and that gives me my stuff, right? You put a lot of vitamin D up there, and when you lose the top of your head, maybe my hair, some people think I've lost the top of my head, but that's a different story. We can debate that later on. Look, here's the deal. Don't put stuff in your body that has a potential capacity to destroy you. If you're going to do something that's silly, it's going to cause a problem. I'm going to give you a product right now that will help. And many of you know about it. It's been around for a long time, but people forget about the easy things. It's called Fever Few. Fever Few. Go into the website that we talked about and get some Fever Few if you have migraine headaches. But better yet, combine that with a visit to your local chiropractor and see what the combination of those things can do for you, maybe permanently eliminating the problem. But Fever Few has been known forever to relax migraine type of headaches, and it does it very well. And it drops inflammatory reactions, and it does some really, really good things for you. But it's available there. You can get it done, take a look at it, and so forth. We're going to be coming up to a break in a moment or two, and I want you to realize something. There's so much that you can do to help yourself. There's so much you can do to get off of medications and off drugs, particularly when it comes to migraine headaches. There's stuff that we can get done. Don't forget, the 18th of March, we got a class that's going to show you exactly what to do about that. Join us. We'll make it happen for you. I promise you. Listen, we're coming up to a break, and don't go away because I'm going to recap it. I'm going to give you a couple other things that I want you to do and that you can make available to yourself. So here's the deal. Don't go away. I'm going to tell you something that will make a difference. And by the way, make sure that the 18th is on your radar screen. We'll be right back after some incredibly important information. But you're going to stay tuned, right? You're going to stay there right now. You're not going to switch me off. You're going to come back because I'm going to give you some data that you're not going to be able to find anyplace else. This is Dr. Tom. Stay tuned. Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Rosell. My patients always ask me to recommend products that I personally use. So I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellcare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Rosell and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Rosell's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomrosell.com/education. That's drtomrosell.com/education.
This is Dr. Tom Rosell, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
So you're still here? Good. I'm glad you didn't go away. You're listening to Dr. Tom, and I'm going to give you some things to use to help that throbbing, that migraine, that triggering, that twinkle, twinkle aura that you get all the time. Even, by the way, if they're ocular migraines, because that's telling you something, that you got things to. But I want to go back to what we started the program with. Do not inject your head with Botox. Please don't do it. It is, in my opinion, based on the clinical evidence of observation of almost 5 decades in practice, that it's not okay. Now, there are, years ago, there was a homeopathic form. There was a homeopathic form of Botox that didn't have any side effects whatsoever. But you know what they did? The FDA came out and said that you can't use botulism, in any form whatsoever. And guess what they just did? They came back and said, Botox is fine. What is it? Botulism. So isn't there kind of a twix there somewhere? I don't know about you, but I said sometimes we're given the data that I think they think that we're stupid, that we can't figure out the data along the way. Well, I'm here to give you all the information. Hey, listen, I want you to understand something, how dedicated we are to you, how much that what we do is about you, to serve, educate, and empower you on your journey to achieve extraordinary health. That's been my passion. That's been my platform for all the years I've been in practice. If you'd like to talk to one of our doctors for a courtesy 20-minute consultation on the phone, all you got to do is call Roselle Center for Healing. Call right now. Call today, 703-698-7117. And if the office is closed, leave a message. They'll call you back. Just say, hey, I want to take advantage of a free 20-minute consultation with one of the Roselle doctors. And they'll schedule that with you, and they'll make it done. They'll make it happen. It's important, right? So make that take place like right now. We're happy to talk to you. We'll guide you. We'll tell you what needs to get done. It's not going to cost you a cent. There's no obligation. There's no hard sell. There's no nothing. And we can't do that in 20 minutes, right? We're not going to tell you to put your husband, your wife online and listen to the sales job. That's not it. You can ask any question you want and ask some questions. Do you think that natural conservative care can help me? And they'll tell you, yeah, or no, or you got to do something else. Let's get back into the program a little bit. We've talked a ton today. I've given you all kinds of stuff. Hopefully, I put a little bit of fear in you, because that was the purpose, to make you wary. Just don't buy into Fifth Avenue marketing. Don't say, oh, you say it's safe. Okay, great. Well, wasn't there a safety tip on something that they came out with a few years back, last 5 or 6? And now we're seeing people with heart disease and turbo cancers and people miscarrying and so forth. I don't know about you, but it gets my attention. It really tells me that maybe, that we need to be a little bit more cautious, if you will, than what we have been. But Botox is not without serious side effects. It can be significant. It can cause paralysis. It can cause ongoing problems that you're trying to get rid of, called pain, right? It can affect your eyes. It can affect your breathing pattern. It can affect all kinds of things. So why do it? Why do it? Listen, March 18th, coming up in a couple of weeks. I think it's 2 weeks from this coming Wednesday evening. Dr. Xinglong Zhang and I, he's a traditional Chinese medical physician and a chiropractor. We're going to be talking about chronic headaches and migraines. That pain in your head that just never goes away no matter what you do? We're going to show you how to make it happen. We're going to show you what you can do about it to resolve it. Listen, the only time that natural care does not work and make things a whole lot better is when there's a space-occupying lesion like a tumor, right? Or there's a blood vessel that's going to pop on you, and it's a big one. But do you know how frequent that is? You're talking about a couple percentages of chronic headaches and migraine patterns. And it's our job as docs to really examine you properly, to find out what it is. It's not by sending you out for MRIs and CAT scans and all these things. If you do a proper examination, you should have a sense of where this is coming from, when it started, the things that make it worse, what makes it better. What were the patterns? Remember structural, chemical, emotional, right? You have to put those pieces of the puzzle together. Listen, I promised you something. I said, if you stuck with me, that I was going to give you some things that could make a difference with these headaches. And I didn't forget, and I know you didn't. So here, pay attention. And you can get these off of our Ageless Health store. Go into the platform, and they're just going to ask you for your email, and that's all it is. You have no obligation. Go through and see if you can find these things. So there's a couple vitamins and some minerals and so forth. So here's the deal. Vitamin B2, like the bomber, B2. It's often used for migraines, and there's a common dosage that's recommended. It's about 400 milligrams per day. Some cases you go a little higher. It's not going to hurt you. My recommendation is always this. Anytime you take a individual B complex, whether it's B1, B2, niacin, which is B3, B12, over time you'll create an imbalance in the other B complexes, and they're water soluble, so none of these guys are going to hurt you. And so you may want to take a very low dosage B complex. There's one that I recommend. It's ionizable form. It's from Biotics Laboratory. You can get that online on that site I'm talking about, Biotics Lab, and it's called Bio B100. It's highly absorbable, but you got to take the B2 individually. B2 is called riboflavin, and it really works. Okay, there's another product called coenzyme Q10, and a lot of you watch the television, and they'll say, this is the brand. Not necessarily. There's other brands like Thorne Laboratories and Biotics Laboratories and so forth that I feel are far better than a lot of stuff that's advertised on television. So CoQ10. It's great for your heart. It works with the regulatory mechanism of the engines within the brain called the mitochondria. It's found to reduce migraine frequency in adults. And typically the dose is 300 milligrams a day. I like to divide dosages up. They work better that way, maybe 100 milligrams 3 times a day. If you forget, take it all one time. Magnesium. Now, magnesium specifically is effective in inhibiting one of those neurotransmitters we talked about. It's called glutamate, and it's an excitatory neurotransmitter, and it's extremely beneficial, if you will, for migraine prevention. So it helps bring it down. The glutamate causes problems, so magnesium will balance it out. And what kind of magnesium? Well, when it comes to the brain, I like magnesium malate, although people say just take any kind of magnesium. Magnesium malate and magnesium glycinate and malate together really do a pretty good job. And you can take that, how much? A couple, 250 milligrams of each one of them a day. So maybe 250 milligrams twice a day. You can break it up. And then our friend feverfew. Feverfew, as we talked about earlier in the program, is a plant. And it works really well preventing migraines. And the effectiveness of feverfew is extremely well known. It's been around for decades and decades and decades. Now, there's another one. It's called Butterbur, and it's called Butterbur. Butterbur contains active compounds. Alkaloids will decrease the migraine frequency. It's a combination of feverfew, Butterbur, all these things I gave you, from B2, riboflavin, coenzyme Q10, magnesium, malate or the glycinate form, and feverfew and Butterbur. Try it. It won't hurt you. And it can make a huge difference in getting you off some of these drugs and these medications that you're taking on an ongoing basis. And by the way, guess what? Magnesium and coenzyme Q10, guess what they're good for? It's called your heart. Your heart, absolutely 100%. Look, go to the full script drop down on our Ageless Health store, agelesshealthstore.com, Check it out and make it happen for you. Why suffer with stuff when there's so many natural things that can be done? Get a chiropractor to check your neck and shoulders out and make that happen. Call our office at rosellcare.com, and you'll see it at the top. Remember, I said 20-minute consultation for you. Our docs will talk to you. And if you're in the Washington metro area, and a lot of you are listening to this, why would I tell anybody that's outside our area to get a free consultation, from one of our docs? Well, just with that, you should know that I'm not trying to reel you in. Would I like to help you? Absolutely, 100%. Our docs are great at doing it. They're amazing. We handpick these guys. My staff has been with me for years, and they keep upgrading. They know what they're doing. They touch it and they'll point you in directions. They'll refer you to other people. They'll say, hey, listen, go to this guy. This is somebody that I would see that if I was in trouble. Remember, we're here continually every Saturday for one reason. You need the information. I want you to be the master of your own ship. I want you to be in control. Remember, Ageless Health. Health is a do-it-yourself program. There's still audio versions available. We still have things that are there. Get it done, my friends. You deserve a life without pain, particularly headaches, particularly migraines that we're talking about today, that vascular explosion, that inflammatory reaction, that hormone cascade that's going up in your system. It makes a difference. It makes a difference. Look, there's so much that's available to you. If you have a question, if you have something that you want me to answer you directly from me, just go to, drtomrosell.com or Dr. I think it's DTR at drtomrosell.com. That's DTR at drtomrosell.com. And I'll answer your question. So any email, DTR at drtomrosell.com. And send me what you want to send me, and I will get back to you, and I'll answer the questions and, tell you what I would do if I was in your position. Tell you what I would do if you were my family, because that's the reason I do the program. Look, this is a quest to put you on life without drugs, without surgery, without medical intervention. There's nothing better in our world than medical care when you're dying and bleeding in the street. They're the ones that are going to save your life. But when it comes to chronic resolution of problems, natural health care is where it's at. The work that we do is what you need to do. We're coming up to the break, to the end of the program. This is, I enjoy this more than anything I can possibly tell you. Please join us on the 18th. Register for the class. Go to drtomrosell.com and do it. And I'll be here next week with a brand new program, another area of interest. And remember, I do it for one reason only. I love you all. You have a great day. See you soon. Bye.
There's two kinds of love in this world. There's the kind you want and the kind you need. But everybody has the capacity to be kinder to one another. It should feel like heaven to make another's day. It should feel like heaven to live a better way. It feels like heaven to be alive, to be alive. It feels like heaven.